Did you know that your lungs can have a profound effect on your brain function, for better and for worse? Yes, they do actually. Your breathing is really important for how well your brain functions. People who have lung problems, such as those who are smokers or develop a condition called COPD, have difficulty with memory, attention, fatigue. Many of them have a higher risk of developing Alzheimer's disease. Yes, if you have poor lung function, you may end up having poor brain function. See, your lungs have two main functions. One of the things they do is to grab the oxygen in the air and put it in the blood so it can travel to the brain and provide your brain cells, which need a lot of oxygen, with plenty of oxygen. Another thing they do is to remove the carbon dioxide, which is the byproduct of metabolic activities in brain and elsewhere, and get rid of them through the alveoli, which is the area of the lung where the gas exchange happens. If you have too much carbon dioxide, your blood becomes acidic, and that can cause problems with confusion and memory loss. Another thing to consider about the respiratory system is the obstruction that can happen in the airways. People who are obese, unfortunately, develop obstruction in the upper airways in their throat and develop a condition called obstructive sleep apnea. Obstructive sleep apnea causes snoring at night and fatigue and grogginess during the day. People who have obstructive sleep apnea experience a lot of shrinkage in their brain, and they are at much higher risk of developing Alzheimer's disease. On a positive note, though, if you do slow breathing exercises, you can reduce your stress and your anxiety. You can reduce the effects of sympathetic nervous system on the heart and the lungs and the brain, and improve parasympathetic nervous system, which makes you calm and peaceful. Respiratory reserve means how much lung capacity you have above and beyond your breathing day to day. Now, the more lung capacity you have, it's better, because with aging, there's some wear and tear that reduces your lung capacity. So the more lungs you have, the more reserve, the more retirement funds you have for your lungs. So why does the lungs shrink and get damaged with aging? One main cause is smoking, or exposure to secondhand smoke, or living in an environment that's a lot of pollution. There's a lot of inflammation that happens because of exposure to smoking or pollution. There's also a reduction in elasticity of the lungs, how well they can expand and shrink. Actually, your muscle walls can become a little stiff, so it's harder to take deep breath when you get older. The muscles of breathing, the diaphragmatic muscles, can also weaken with aging. The good news is that all of these things are reversible. Your lungs have cells, and these cells can regenerate, just like your skin, your liver. Your lungs can also generate new cells, so you can have a fresh and young-looking lungs, even if you've had exposure to smoking or pollution, or even if you have some effects of aging on your lungs. So what are the 3 things you could do to improve your lung function and capacity? One of the best things to do is to exercise. When you exercise, you improve your lung function, you expand your lungs, you use your lung muscles, and it makes all these well toned up and strong. Another thing you want to do is to stay away from pollution and stay away from smoking. You want to eat a diet that reduces inflammation in your body. A Mediterranean diet is really good for you. Finally, you want to take advantage of the fact that slow breathing can do wonders for your brain. When you do slow breathing for, like, say, 10 minutes or 20 minutes per day for 5 days a week, you can calm your mind, increase vagal tone, which slows down your heart rate, and increase something called heart rate variability. These effects make you calmer and less nervous, and can reduce anxiety, which is a good thing for the brain. So, if you want to have a healthy and strong brain, you need to work on having healthy and strong lungs, and those interventions can do wonders for you. Good luck.